Hello, CBU PsyD program prospective applicant. My name is Dr. Joshua Knabb. I am a board-certified clinical psychologist. I'm also the program director for the CBU PsyD program. I want to spend a couple of minutes here with you telling you a little bit more about the program and why I think you might want to seriously consider applying to our 5-year program. First off, what I like to start off with is to talk about clinical psychology. So why pursue a 5-year program to become a clinical psychologist? Well, I think a clinical psychology doctorate prepares you to do a lot of different kinds of things in the mental health field in integrated healthcare settings. More and more psychologists are playing a role in contributing to the field. So notice that here the definition of clinical psychology, according to APA, their Division 12, which is the Society for Clinical Psychology, we're talking about the application of principles, methods, and procedures, so quite a bit there, for understanding, predicting, and alleviating, notice here, the intellectual, emotional, biological, psychological, social, and behavioral maladjustment, disability, and discomfort applied to a wide range of client populations. So there's a lot there, and I think that captures really the broad range of things that we can do in our field. We can wear lots of different hats. So why become a clinical psychologist? Well, we can do a lot of different things with a doctorate, with advanced training, with a psychology license at a state level. So the first thing is that we have advanced training at the doctoral level. Because of the importance of responding to a suffering world with advanced training, we want to be prepared to do so. We want to be able to prepare you to lead organizations, to have the leadership skills necessary to advance clinical psychology at the highest possible level. We also have, within the program, I think, the opportunity to do a lot of different things, which means that you'll have flexibility when working in the field. You're not going to just do one thing all day long, but there are lots of different opportunities to be a researcher, to be a clinician, to do assessments, to do psychotherapy, to do consultation, to do lots of different kinds of things in the field beyond just one thing for 40 hours a week. We also spend quite a bit of time in the program talking to you about balancing practice and science. What does that mean? That means that we prepare practitioners to go on to get licensed and to serve in the field by working directly with consumers of mental health services. But we also take seriously the science of what we do, which means that we also help you to understand peer-reviewed research and for some of you contribute to the original peer-reviewed literature as researchers. So the aim of our program here is to prepare doctoral students for psychology licensure and entry-level practice in the field, with lots of different kinds of mental health professionals contributing to multidisciplinary treatment teams. We want to prepare you to be able to serve. Key features in the program include that we emphasize throughout the program individual and cultural diversity. We emphasize going directly to original peer-reviewed sources, and we integrate the Christian faith so that we can help you to work more effectively with Christian clients, being that we are a Baptist institution. So it's an ongoing conversation. Being that we're a practitioner-scholar model, we balance the science of what we do with the practice of what we do. And so we have a clinical training sequence that helps you to do so, to develop into a practitioner. We also have a research and dissertation sequence, which helps you to develop into a scholar. So for some of you, you will maybe want to go on to primarily work with clients in an applied setting, and some of you might want to go into teaching in higher education and to actually contribute in original ways to the peer-reviewed literature. A few misconceptions as I begin to wrap up here. One is that I need a master's degree first. I would actually say that although we do accept applicants or applications from people with a master's degree, that our ideal applicant is going to be somebody coming right out of a bachelor's program, because we have a master's degree that's built in along the way. So after 2 years of the program, you can apply with the registrar's office to get a master's degree. Also, sometimes people think that a master's level license is a quicker route. I would say that's not the case with our program, because there's a built-in full-time internship in the 5th year of the program, and then once students complete a postdoctoral residency after graduation, they have the hours necessary to pursue licensure. So going the route of maybe getting licensed as an MFT or an LPCC or an LCSW, that's not the quickest route to get licensed as a psychologist. Sometimes we also think that either we're not qualified or prepared, or the GRE is too difficult. I would encourage you to consider that we really look at the application in its totality, which includes GRE scores, but that's not the only thing that we look at. So I want to have a conversation with you about your application beyond just, one specific part of the application. And then lastly, career opportunities. You can do lots of different things, as I mentioned before, intervention and assessment, working in a wide variety of settings that I have listed here, higher education if you want to go on to become a teacher, consultation and research. So lots of different ways to contribute to, helping to address suffering in this world that we live in. So a psychologist, at the end of the day, if I go back to this description, can do lots of different things. So please give us a call, email me, or go to our website here, which has lots of information as well. Thanks.